Welcome back to the Kiosk Presents. My guest today is Dr. Roshini Raj. She's a nationally recognized women's health expert and author of What the Yuck? The Freaky and Fabulous Truth About Your Body. Dr. Raj, thank you for joining us here on the Kiosk Presents.
Oh, I'm glad to be here today.
So I read that a recent Health.com survey said that 67% of women are afraid to bring up what they feel to be embarrassing issues to their doctor. What are some of the embarrassing issues that women don't want to talk about with their doctor?
Well, it depends a bit on how old they are. And, as we get older, there are different health issues that affect us in different decades. So I think women in their 30s are often quite concerned with their appearance, and they may do certain things to kind of be more fashionable or more beautiful that could actually affect their health. So one of those is wearing these tight-fitting undergarments or shapewear. If you do this excessively, it could lead to an increase in yeast infections, for example, because there's a lot of warmth and moisture in that area. It could also lead to a lot of abdominal discomfort if you suffer from irritable bowel syndrome and bloating, because there's no room for the intestine to expand the way it normally does. As we move on to the 40s, then women are often finished with having children, and they're sort of looking at their bodies and trying to figure out what has happened to their bodies. Trying to lose some weight is certainly an issue, but also they may have noticed that their feet have increased in size. And this could be a normal consequence of pregnancy. When we are pregnant, we release a hormone called relaxin, which helps relax our pelvic ligaments to make room for the baby. But that same hormone can also relax other ligaments in our body, including our feet. And that could lead to a widening of the foot and an increase in shoe size. As we move on to the 50s, this is when women start to experience some bladder problems potentially, and one is stress incontinence. This is where a woman notices a little bit of leakage of urine if they're laughing very hard or coughing. But there's another condition called overactive bladder, and I'm excited to be working with Oxytrol for Women today to talk about that condition. It involves urinary frequency, urinary urgency, or accidents, at least 2 out of those 3 symptoms. And there's now a new over-the-counter treatment option for that called Oxytrol for Women, which basically involves a clear patch that you put on your skin. It lasts for 4 days. And within 2 weeks, it can really help resolve the symptoms of overactive bladder.
So how can women become more educated about their health concerns?
Well, there's so many resources out there these days, which is great. You do have to be a little careful to make sure the information you're getting is accurate. I think that online there's some great resources from academic medical centers like mayoclinic.com, for example. Speaking with your healthcare professional, your pharmacist, and just in general, speaking up, talking about these issues, doing your research. Don't just ignore something because it's uncomfortable or embarrassing to think about or talk about.
And why is it important for us to try to get over or be more comfortable with embarrassing topics?
Well, you really have to be your own advocate when it comes to your health. You know your body best. You know when something's not working correctly. And these days, with such short doctor's visits, you don't have a lot of time in the office. It's really up to you to bring up all the pertinent information that your doctor may not think to ask about. And sometimes, not talking about a problem will not only make you suffer unnecessarily, but could also make you experience a long-term, more serious issue because you're not dealing with it early on.
So earlier you had mentioned, like with pregnancy, your feet can get wider, your feet can get bigger. What are some kind of weird or embarrassing medical conditions that are actually quite normal?
I think one thing that a lot of women experience as they get older is they start to see unwanted hair in areas of their body where they never saw it before. It could be on their chin, it could be on their chest, and it could be quite alarming when you first notice it. This is something that it can be very normal. As we get older, our hair gets on our body gets thicker and darker and coarser, not like the kind of fine, less noticeable hair when we're younger. So you start to notice it more. Unfortunately, the same is not true for the hair on your head. That tends to get thinner, actually. So these are all issues that happen as we age and shouldn't really be a cause for alarm, but there are things you can do about it. You certainly can, investigate some hair removal options if you don't want that hair on the body.
So where can we go for more information for health concerns when it comes to aging?
Sure. Well, for overactive bladder, you can go to oxytrolforwomen.com. And for health concerns in general, you can go to my website, drroshiniraj.com.
Well, Dr. Raj, thank you so much for joining us here on the Kiosk Presents in Buffalo and Western New York. Everybody check out her book, What the Yuck? The Freaky and Fabulous Truth About Your Body. Thank you so much.
Thank you so much. Have a great day.